Hi guys, my name is Bhavishek and today I'll discuss a new topic, that is Introduction to Dental Anatomy, right? So first of all, we'll try to learn the basics, okay? That's very important for us to get the full idea of the concepts and the terminologies used here, okay? So guys, here what you see is a lateral view of the skull, okay? And we'll try to label them. So for example, we have a bony structures of the face and the skull. This becomes a, let's suppose, number 1, okay? And then we have a structure that is here. Let's suppose it becomes the number 2 structure. Then this is the 3, this one in the red becomes the 4, and this becomes the 5, right? And then let's go for this one. This is the 6, this becomes the 7, and this becomes the 8. So we have remaining here is 9, then comes the 10, and finally the 11. That's it. So we'll try to label all the bony structures here, right? So guys, so first we have is the mandible, okay, and second we have is the maxilla. So mandible, you know, is the lower jaw, okay, and the maxilla is the upper jaw. So write it down, okay. Number third we have here is the nasal bone, which forms the bridge of the nose, okay. Now one more thing here is that the mandible is 1 in number, the maxilla is also 1 in number, but nasal bones, they are paired structures, they are 2 in number. Next is the ethmoid, which is the middle cranial bone, okay, and this is also 1 in number. Next we have the fifth, that is the lacrimal. This becomes the lacrimal, and this forms the walls of the orbit, and these are paired, okay. After that we have is the sixth, that is the frontal. So you can see this is also called as the frontal bone, which forms the forehead, that is 1 in number, okay. Then what do we have is 7, that is the parietal. So this forms the top of the skull, and these are paired structures, okay. In the 8 we have is the occipital bone, which forms the posterior part of the head. So occipital also is 1 in number, okay. And then what do we remaining here is 9. So guys, 9, as you know, this is the temporal bone, okay, and this forms the lateral wall of the skull. So the temporal bone is attached or articulates with the mandible, this one, at this particular site, okay, and this particular articulation is called as temporomandibular joint. That means a joint in which there is the articulation of the temporal bone, okay, and the head of the mandible, or simply the mandible, okay. So 9 number is the temporal bone, and 10 number that we have here, this is the zygomatic, yes, and this forms the cheeks. Zygomatic is also paired structures. And 11 we have is the, yes, this is the sphenoid, that is the midline bone. These are 1 in number, okay. So guys, our main focus should be only up to the mandible and the maxilla if I talk about the dental related structures, okay. So write it down all these points, and then we'll move on to the next part, that is the detailed description of maxilla and the mandible. So guys, first let us talk about the maxilla, okay. So guys, the maxilla is also called as the upper jaw, right? It is also called as the upper jaw. Now this maxilla, it forms, right? It forms the upper part of jaw, number 1 point. Number 2, it forms the floor of mouth. You can see here, this green one here represents the maxilla, okay, and it forms the floor of the mouth. Number 3, it also forms part of the eye orbit and nose. This becomes the eye orbit and the nasal structure as well, okay. That is the maxilla. Now some more few points. So the maxilla basically holds the upper teeth, or you can say the top teeth. So it holds the top teeth, right? Again, this maxilla also supports the muscles that are involved in, number one is the mastication and also the facial expression. So guys, one more thing here, the mandible what you see is the largest and the strongest bone in the face, okay, and the maxilla what you see here is the second largest bone in the face. So this becomes the second largest bone in the face. That is all we have to know about the maxilla, okay. So write it down. So next we'll move on to the mandible. So guys, the mandible basically is called as the lower jaw, right, and this is the, as I told you, largest and strongest bone of the face, okay. Number second point, this holds the lower teeth, you can see here, or we can say simply bottom teeth. There is attachment of muscles which help in the mastication and mouth movement, okay. But one of the characteristic feature of the mandible in this whole structure is that the mandible is the only movable part or bone of the skull. So we can say only movable bone of skull, okay. It's a very important point. And how does it move? With the help of the TM joint, okay. So now let's talk about the next, that is the three basic tooth form. So before the next, that is the three basic tooth form, first I'll try to explain you that why do humans have teeth, that is what is the purpose of human dentition, okay. So guys, as you know that this jaw, that is the mandible and the maxilla, they comprise of teeth. You can see here that is the upper and the lower teeth. Now what are the functions of the teeth? Let us talk about that also. So in the function, the first is a very basic function, a very common function, that is the mastication or chewing of food, okay. Now can you name some other function as well? So they can be, let's suppose it helps in phonation, that is helps in the speech, then it gives good aesthetic appearances, okay. So we can write aesthetic appearance, and it also helps the tongue to make the masticated food into a bolus. So we can write that it helps the tongue to convert the masticated food into bolus, as this will allow easy swallowing of the food. So guys, bolus basically means the food is mixed with saliva, and if there is a bolus formation, so there would be easy swallowing. So we can say easy swallowing. That is also a very major purpose of teeth, okay. These are the functions of the teeth, okay. So guys, we have three particular terms that we come across if I talk about the human dentition, right. So the first term is what we call as the thecodont, okay. Then we have is the diphyodont, and then we have is the heterodont, okay. So guys, the name suggests thecodont, that means the teeth are embedded within the sockets of the jaw. You can see here these are embedded in the sockets of the jaw on the upper and lower side. So we can say that it is attached to the sockets jaw. Number second, diphyodont means that the human dentition specifically have two sets of teeth, right. So we can say that it means two sets of teeth, that is we know one is the primary or deciduous, second is the secondary or permanent. I'll talk about this also in detail about the differences between primary and permanent, okay. The next we have is the heterodont, that means there are different types of teeth. You can see that the teeth are larger in shape, some are larger, okay, some are broader and some are pointed also. Human dentition comprises of different types of teeth. So these three terms are very important and you should know about this as well, okay, right. So guys, in the heterodont what we see is the three basic tooth form, this one. we have the three basic tooth form. That is, first is the incisive form, that is the incisors, which are the cutting and the biting teeth. Okay, then we have is the canine form, that is the canines, which are helping in the tearing of the food or the flesh, so that are called as the piercing or tearing teeth. And the last we have is the molary form, that comprises of molars and the premolars, which are the grinding teeth. It helps to crush the food. So guys, I talk about all these teeth, that is incisor, canine, the molars and premolar in detail, so don't worry about it. But first I'll talk about the surface of tooth. That is, it's a very important topic, because you would always come across dental surgeons using this particular terms like mesial, distal and facial, or any other also. Like if they can say that a patient is having proximal caries. So what do you mean by proximal caries? So in that cases you have to understand what these basic terms mean. Okay, so it seems a very bit complicated, but it's not so. I'll try to explain you in a very easy manner. Okay, so just stay with me. So guys, here what I have is a jaw set, as you can see. Okay, and it represents a jaw of my mouth, for example. Okay, and just like I have my midline here, this is my midline. So just imagine this is also the midline. Okay, that is the midline of the face intersects with the midline of the jaw. Okay, now, so guys, what you have to understand here, that the first is the mesial surface, that is a surface which is facing towards the midline. So if this is the midline, and if I talk about this tooth here, so we have the surface, this one, which faces towards the midline. Okay, for example, I talk about a tooth like, let's suppose the canine. Okay, so the canine has two surfaces which I see from this side. So if there is a surface which is towards the midline, we say it is a mesial surface, and if there is a surface which is away from the midline, that is this one, you can see it is going backward, not towards the midline, we call it as a distal surface. Okay, so if I ask you a question that this is, let's suppose, my lower mandibular first molar, okay, and you have to guess that which of the following surfaces is a mesial or distal. So you can say, in this case, as you can see here, right, so we have the midline like this. Okay, and here we have two surfaces, that is number 1 and number 2. So this surface is towards the midline. Okay, this becomes a mesial. This surface is away from the midline. You can see here it is getting away from the midline, so we say it is a distal surfaces. Okay, right, we have surface towards midline of the face, that is a mesial, and surface away from the midline of the face, that is the distal. Okay, so next we have is the term that is called as the facial surface. So guys, facial basically it involves two, that is, first is the labial, and then we have is the buccal. So guys, the surfaces which face towards the lip is called as the labial, and the one facing towards the cheek is called as the buccal. For example, guys, try to understand here that this represents my jaw, and here is my lip, this becomes my cheek. Same also applies here. This is the lip area and this is the cheek area. Okay, so if I talk about the incisors in the lower, for example, so this surface which is facing towards the lip is called as the labial surface, right? Okay, now you don't see the cheek in the front. Okay, so we can never say that the front teeth or the incisor teeth have a buccal surface. No, they will always have a labial surface. If I talk about the molars here, okay, the molars are towards the cheek. Okay, that means this surface, this particular surface is the buccal surface facing towards the cheek part. Okay, so we have the labial, buccal also, and collectively they are called as the facial surfaces. Okay, that is surface facing cheeks or the lips, particular teeth. So now what are the surface that we have discussed here? So first is that this surface is having left and right, that is a mesial surface towards the midline, you can see here, and distal surface away from the midline. Number second, okay, the surface is facing towards the lip, this becomes the labial, and the inner side is the surface facing towards the tongue, that is the lingual side. Okay, or lingual surface. Next we have is the incisal and the occlusal. So guys, incisal means the biting edge of the anterior tooth. So guys, what do you mean by anterior tooth? So you can simply understand by this thing that, guys, anterior means the tooth from canine to canine. Okay, and the posterior means from the premolars to molars. How come? So guys, just look here. Let us say we talk about the maxilla part. So we have the canines here. Okay, then we have is the lateral incisor, central incisor, again central, lateral and canine. So this set of teeth from canine to canine is the anterior teeth. Okay, and now just talk about here. We have the premolars, again premolar, second premolar, first molar, second and the third molar. So this set of teeth is called as the posterior teeth. Okay, the same applies for the upper and the lower jaw and all the quadrants as well. Okay, in the lower we have from canine to canine we have is the anterior teeth, and from the premolars to molar we have is the posterior teeth. Okay, so the anterior, that is the canine to canine, all you can see is that all they have a pointed edge, they have a sharp edge. So we say that these surfaces have incisal surfaces. Okay, these surfaces have incisal surfaces. Again, now from premolar to molar you don't find any kind of pointed edges. Okay, what you see is a broad surfaces, which is also called as the occlusal surface. As you can see here, this becomes the occlusal surfaces. So remember, if we talk about the anteriors, we'll always say incisal. If we talk about the posteriors, we'll always say occlusal. We cannot say that the molars are having incisal edges. No, it's wrong. We cannot say that the incisor or the center incisor is having an occlusal surface. That is also wrong. The anteriors, which includes canines, central and the lateral incisors, they will have incisal edge, and the posterior, which includes the premolars and the molars, they will have an occlusal edge. Okay, or the occlusal surface. Next we have is the proximal surface. This is very important, guys. Okay, I talked about the proximal caries, right, that I was saying. So let us try to distinguish here. So for example, if I consider a tooth which is this one, this is the first molar. Okay, first mandibular molar, this becomes my midline. Okay, and if I talk about this first molar, so we have a surface, this one, surface number 1 and surface number 2. So you have to guess it. The number 1 surface is towards the midline. Okay, so this becomes the mesial surface of the first molar. Now surface number 2 is away from the midline. This is the midline, it is getting away from the midline. This becomes a distal surface. Okay, now we talk about the second molar. Let's suppose the second molar also we have a surface number 1 here, or surface number, let's suppose 3. So 3 number surface is also facing towards the midline, and the fourth surface is facing away from the midline. That becomes a distal. So if you look closely to this particular part, so there is the distal surface of the first molar and there is the mesial surface of the second molar. Again I repeat, you can see that this part is the distal surface of the first molar, and thus this is the mesial surface of the second molar, and collectively we call it as proximal surfaces. That is, both are different tooth, mesial of one tooth and distal of another tooth. So guys, let us try to magnify this tooth, that is your first molar and the second molars. Okay, so it appears to be somewhat like this. Okay, as you can see, this is the central, lateral, then canine, first premolar, second premolar, and we have the first molar. So this becomes the first molar and this becomes the second molar, the mandible molar. Okay, so now guys, just look at here, we have the midline this way. Okay, and the surface is which is facing towards the midline is called as the mesial surface. So in this case, what we have is the mesial surface, like this one. This becomes the mesial surface, right? This is the mesial one. Okay, this one becomes the distal, that is away from the midline. So this becomes the distal surface of the first molars. Now go backwards again with the second molar. In second molar again we have a surface towards the midline. This, it becomes the mesial surface, and the back part is the distal surface facing away from the midline. You see that there is no lip surrounding here. Okay, what we see is the cheeks, this part. Okay, just look at here, we have the cheeks. Okay, so that is why we say that this particular surface, this one, this is called as the buccal surface. Okay, so you have the buccal side here and you have the tongue in the inside. So this becomes the lingual side. This becomes the lingual side. Okay, occlusal surface. Okay, and the proximal, guys, you know, I said you that the mesial of one tooth and the distal of another tooth. In this case, I can say that this is the mesial of tooth number second molar and this is distal of the tooth number, that is the first molar. So this together is called as the proximal surface. So that's all about the surface of tooth. So now we'll talk about the next, that is the type of tooth is represented by initial letters, that is I, C, P and M. So guys, I is for incisors, right? C is for canine, P for premolars and the M is for molars. Okay. So next we have is the human dentition. So this is very important that we have to understand. So guys, the human dentition, what you see here, we have a specific term called as a dental formula. Okay. So what is dental formula? We won't revise it, we'll simply try to understand it. Okay. So let us take the jaw set again. So guys, in this jaw set, we have the two sides of the jaw. Let's suppose this is the one side of the jaw and this is the other side of the jaw. Okay, so I'll consider only the one side of the jaw. Okay, and this is for the permanent dentition. So let us talk about the permanent only. So in the permanent, guys, what you see here, check it out. So first we have is the incisors. Okay, so let me write it down. Here we have is the incisors. In the permanent, how many incisors do you see? So you can check it out. So in one side of the jaw we have number 1 and 2, and also in the lower we have 1 and 2. So I can write, in the upper I have 2 incisors, in the lower also I have 2 incisors. Okay, next we go for the canine. In the canine, guys, you see, in the upper we have 1 canine, in the lower also we have the 1 canine. That is only one side of the jaw, so we write it down 1 and 1. In the premolar, how many do you see? So we have the 2 premolars on the upper side and 2 on the lower, so this becomes 2 and 2. And in the molar we see how many? So this becomes 1, 2 and 3. It's also become the 1, 2 and 3, so this becomes like this. So this formula, as you see here, is represented only for the one side of the jaw. Okay, in the deciduous teeth, that is the primary dentition, what you see is that there is absence of these premolars. There is the absence of the premolar teeth, and also the last molar, that is the wisdom tooth, is also absent. So we can have a formula here also that in the incisors remains the same, that is 2 and 2, upper and lower. Canine also remains the same. Okay, the premolars are absent here, and we have the one molar, that is the wisdom tooth, which is also absent. So we say the molar becomes how much? 2 and 2. In simple terms, you would also come across in the book, that is, it's written 2, 1, 2 and 2, 1, 2, 3. That is all about the dental formula. Okay, that is what we have understand here. So for example, if I have to complete this whole set, that is the 32 number set, how can I achieve that? Okay, so guys, let us say we have the 32 teeth. Okay, so let me try to complete this whole 32 teeth. Okay, so in this whole 32 set, we have the 8 incisors, out of which 4 are central incisors and 4 are lateral incisor. That means from the centered area, if you see, the tooth which is at the center is called a central incisor, and the tooth which is lateral to it is called as the lateral incisors. Okay, next we have, that is the 4 canines. Okay, so guys, the canines is also called as cuspids or the eye teeth. Okay, you can see here number 1, 2, 3 and the 4, that is 4 canines. Okay, next we have is the 8 premolars. Okay, out of which 4 are the first premolar. Okay, which is also called as the first bicuspid. Yes, the premolars are also called as bicuspids. Similarly, we have, that is 4 second premolar, which is also called as the second bicuspids. Okay, so we have 8 incisors, 4 canines and the 8 premolars. So what we are remaining is the molars. So guys, in the molars we have 12, out of which the 4 includes the first molar, the next 4 includes the second molar, the next 4 includes the third molar. It is all about the 32 set of teeth. So if I talk about the deciduous teeth, that is in the primary dentition, what do you see? That in case of deciduous, we have 20 teeth. Okay, incisors remain the same, canines is also the same, the premolars are absent, so this becomes the absent. Okay, and also in the molars we have the absence of third molar, so this becomes the absent. This is also a absent. So if you now calculate it here, so how many molars do you see? 8. Okay, and these are also absent, so we have 8 plus 8, 16, and then we have plus 4, so it becomes 20. That is the deciduous teeth. Okay, now let's talk about the next, that is the arrangement of the teeth. Okay guys, so what you see here is a very complicated diagram, it appears so, okay, but it's not. So if I simply unlock the jaw set, okay, and if you open it up completely, it appears like this. This is the figure that has been drawn here. Okay, so now I can simply name the tooth, right? For example, I say that this becomes tooth number 1, this is the second number tooth, third, fourth, fifth, sixth, seventh and 8th. That's it. So guys, now what do you see first? That we have the two arches, that is upper and the lower arch. So guys, upper is the this one arch, and this becomes the lower arch. So we say this is the maxilla, and this becomes the mandible. Okay, we have two arches, and then we have two quadrants each. So guys, as you can see, the upper arch contains number 1, number 2 quadrant, and this also contains number 3 and number 4 quadrant. So we can say this is none, this is the 2, this becomes the 4th. Right, 16 teeth in each arch. So guys, one arch contains how many teeth? That is the 8 teeth. Okay, again we go from this side, so this becomes 1, 2, 3, 4, 5, 6, 7, 8 here. So we have central incisor, lateral incisor, canine, first premolar, second premolar, first molar, second molar, and the third molars. Okay, so 1, 2, 3, 4, 5, 6, 7, 8. So guys, here also we have is the 8 teeth, and together this contains how many teeth? That is the 16 teeth in each arch. The same goes for the lower as well. So here also you can write it down 8, 7. So guys, don't make sure that you don't write like 1, 2, and 3, because in the back side we always use the term that is the 8 number teeth. That is the third molars are 8 number teeth. Then we have is the 7, 6, 5, 4, 3, 2, 1. Here also 1, 2, 3, 4, 5, 6, 7, and the 8. Okay, so guys, that is all about the first part of dental anatomy. Now in the next videos I'll discuss about that is the tooth number system. We can talk about the various, that is the FDI system, universal system, Zigmondian, Palmer. Okay, and after that video I'll talk about the basics of the primary and the permanent dentition, the difference between the primary and the permanent, and how to differentiate between both the set of teeth. Okay, so I think you have enjoyed the video guys, so do like, share, subscribe, and comment down below topics you want me to make a video on. That's all for today. Thank you and have a nice day.